Hi, I'm Allison Hart. I'm the CEO of the Gresham Area Chamber of Commerce. Welcome to our May Government Affairs Forum. Our topic today is the Affordable Care Act and the impact on business, and I'm sure that we all have a lot of questions, particularly in the state of Oregon with the changes with Cover Oregon, and so I personally am very interested in this topic today. I'm going to leave the introduction of our distinguished panel to Andre Wang, who's going to be our moderator today. I really want to thank our sponsors as well who make this program possible. Larry at Riverview Community Bank, thank you. PGE and Gresham Barlow School District have all been longtime supporters of our program. I'd also like to acknowledge our elected officials. We have Gresham City Councilor Kirk French and Fairview City Councilor Ted Tosterud, and of course Jerry Hinton, who's one of our speakers. And also acknowledge our board of the Chamber, Lynn Snodgrass, Warner Allen, Matt Miller, there we go, thank you, who is our president of the board. And our chair for this year's Government Affairs Committee is Warner Allen. So with that, I'm actually going to turn it over to Andre to introduce our panel and lead us into our program.
Thank you, Allison. Good morning, everyone. Well, thank you very much for coming to talk about this very timely topic. Living in Oregon, we live in a very interesting laboratory when it comes to healthcare reform. Not only do we have the Federal Patient Protection and Affordable Care Act, but we now have sweeping state healthcare reform. And so now we're dealing with concepts of insurance exchanges, coordinated care organizations, accountable care organizations. And so last year we discussed what this means to businesses and consumers. Now that we're into implementation, we have a better idea what this means to us. So today we have a panel that is experiencing and perhaps enduring healthcare reform and on the front lines, and they'll be here to break it down for us. We actually have two panelists that are in the field of the healthcare industry and two panelists that are on the front lines to give us some anecdotal evidence and experience on healthcare reform. Our two panelists to provide that anecdotal experience is Mark Garber and Jerry Hinton. For 10 years, Mark, of course, we knew him as the executive editor of the Gresham Outlook, and today is the president and publisher of the Portland Tribune and community newspapers, which includes the Gresham Outlook. He is responsible for the management and personnel within the fleet of the Tribune's newspapers, but Mark does what he does best, observing current events and reporting their implications to the public. Jerry Hinton is a 10-year resident of Gresham, but is active serving on the city's Finance Committee and Citizens Involvement Committee. He is a Gresham City Councilor and today is the General Manager of Brazzers Auto Auction. He is also the incoming president of the National Auto Auction Association for next year. Now our industry specialist, Tina Kennedy, is an insurance agent with Jackson Benefit Services and has been with the insurance industry for 18 years, both in Colorado and Oregon. She's the past president of the Oregon Association of Health Underwriters and served on their board for 7 years. She has also been involved with Cover Oregon in an advisory capacity for about a year and served on multiple committees with them. Finally, Tina has been the recipient of the Best Aunt Award by her nieces ever since 2007, so she should be recognized for that. Tim Rash returns to visit us. He is the senior benefits broker at Larry Sherwoods and Associates, specializing in business and commercial plans. He's served in a legislative capacity for the Portland Health Underwriters Association for 6 years and also serves on the board of the Portland Human Resources Management. Both Tina and Tim are renowned speakers on the practical effects of healthcare reform and will give us lowdown on healthcare. So please welcome our panel this morning. So this question and we're going to take a little different format this morning. We're going to basically keep this as an extended Q&A. I have a series of questions, but we open the floor to your questions as well. If something question comes up, raise your hand and chime in, and I'll run over with the microphone. This question actually is for our two industry specialists, but for the whole panel, and it's this: with Cover Oregon, what happened? with so much information or misinformation out there, how did we end up, or how did Cover Oregon end up in the situation it is now, and where do we go moving forward? We'll start with maybe Tina and work our way down.
Thanks, Tim. I'm not going to stand. Can you all hear me okay? All right.
Well, for the video, I think we need you.
Oh, I'm sorry. All right. Good morning. Is this better? Everyone, hello. Okay, what happened? Well, who can say what, there are a lot of actually different stories. Tim and I were talking about, we have a lot of friends in the industry, not only within Cover Oregon, but also without. I was telling him that from my friends' perspective who work at Cover Oregon, I didn't really hear a bad word from them about things that, leadership-wise or management-wise that went on inside, but kind of step out the front door and it's a completely different story. So who's to say? The truth, I'm sure, is always somewhere in the middle. Not exactly what you hear on the news, not exactly what you hear from employees of Cover Oregon, but again, somewhere in the middle. As Tim and I were talking earlier, water under the bridge. At this point, what happens now? The biggest problem with Cover Oregon was the functionality of the website. You've heard about, the website debacle. From an agent's perspective, there was actually a lot that we could do the whole time. For a long time, we could go into the subsidy calculators. We could take someone's information, see if they qualified for a tax credit or not, see what that would be. We could shop for plans. And then a couple months in, we could actually enroll someone from start to finish. We could start from scratch, estimate their subsidies, shop for plans with them, and electronically enroll them. Great. The dream was, though, that you were supposed to have been able to do it on October 1st, and that's what didn't work. So that's on the front end. On the back end, all of the information that we put in didn't really go anywhere. It kind of went into spreadsheets and was then sent off to the insurance companies where it was manually entered, and we're talking about thousands of people. In fact, hundreds of thousands. These enrollment stats I have as of May 15th. Let me see, they enrolled 198,976, so almost 200,000 people enrolled in the Oregon Health Plan. Some of those had been in before, but probably 60,000 were added this year for the first time, 60,000 new enrollments. And then about 81,000, they think, enrolled in private medical insurance plans. So that was a lot of people that were helped by tax credits and so forth. But again, all that data was collected no matter how it got put into the system. But then it took so long to get everybody in the systems because it was all manually done. The interfaces between Cover Oregon and the health plans just wasn't there. It wasn't working. So that was, the debacle there. Oracle could make it work in Washington. They made it work. I don't know if they did it in California. I think somebody else did it in California. But of the 13 states that decided to do their own exchanges, ours is kind of the biggest, nationally known non-winner of that whole effort. So anyway, so that's that. So at this point, as you've heard on the news, Cover Oregon is going to kind of remain as it is. They'll still process all the Oregon Health Plan applications. Is everybody familiar with Oregon Health Plan? State's Medicaid program? It's Medicaid, but what we call it here is Oregon Health Plan. So for one person, it's about $16,000 is the income bracket. For, let me see, I'm trying to think. The next one up is like $24,000 for a family of two or two household members. If you make that or below, it's a free program. There's no monthly premium. For adults, there are $3 copays for office visits, prescriptions. I think the highest copay I saw for someone on the Oregon Health Plan is a $100 copay, and that's for an organ transplant. Yeah, for $1 million surgery. So anyway, and then if you're under 18, there are no copays. It's called Healthy Kids at that point. It's the same program. Anyway, and I'm kind of getting off point here and taking up too much time. But Cover Oregon will still process those applications. Anybody who has been enrolled through the Cover Oregon system will stay there. Anybody new from about, starting in the next open enrollment period, anyone new who comes on at the end of this year for January will be enrolled through healthcare.gov. So anyway, that's sort of where things are. Turn it over to Tim for any additional thoughts if you've got that, or did you want to
Actually,
take another question?
perhaps also address, now that we're going to the federal system, what does that also mean practically moving
I don't know,
forward?
it's going to work perfectly. Truly, I don't know yet. I'll be fascinated to see. There's been no training, no communications for agents as far as what the future holds. And if we don't know, if you find out, tell us. That'd be great. We'll find out. I mean, not even every health insurance company in Oregon is contracted with the federal exchange yet. So, Tim was saying, Providence for one. We don't, they'll probably contract with the federal exchange. We don't know that. I would be shocked if they didn't. But we'll see. I mean, there's no information yet. At this point, they're still trying to pay us for the people that we did enroll since January. So that'll be interesting to see if that happens too. But anyway, those are my 2 cents. Sit down here. We good?
Tim.
I think a lot of the confusion also stemmed from the buying public with the marketing and the advertising of Cover Oregon, making it seem like that was the conduit that you had to go to buy insurance in Oregon. But in essence, that couldn't have been farther from the truth, because really Cover Oregon's sole mission was, as Tina was alluding to, was kind of twofold. If you were on the Oregon Health Plan, or if you qualified for now the new Medicaid programs, that was kind of conduit one. Conduit two was, okay, you're not quite part of the free program, but you have some income, some money coming in, so let's qualify to see if you get a federal subsidy through the Affordable Care Act. That should have been their mission, and their own mission solely through that. They also wanted to talk about the small business tax credits through the SHOP. And then once the federal program through the SHOP was delayed, then Oregon stopped all of the resources for that. But they had wasted so much time and money, because from our vantage point, what they really wanted to do was make this an all-encompassing conduit for all Oregons to come in, and everybody buys insurance through Cover Oregon, but it was too much of a massive project. And we told them from day one, back when the Oregon Health Authority, I think it was in '97, was starting Oregon was already going down the slippery path of creating our own independent exchange way before Obama became president. And there was just too much fruit on the tree to make any sense of what their main accomplishments, what their main objectives were. So we had known for years that this debacle just was not going to happen, because there was just too much going on without any firm, fine direction on what's the first thing we need to do. Okay, we need to take our Oregon Health Plan people, migrate them over so that group stays insured. Then we need to promote and educate and communicate. How is it that if you're not on Oregon Health Plan, you qualify for a subsidy? And they should have just kept it at that. Because one of the things that got missed through this is that as an Oregonian, as an individual, when the law became that we all had to have insurance, we have a very robust insurance economy here in Oregon. We have some of the most per capita insurance carriers than just about any state in the country, with now, 10 domiciled insurance companies. We have our own, based on competition, we have our own basic exchange going as it is for small businesses, large businesses, and individuals. And the message that got lost was, if you're outside Oregon Health Plan, if you're outside the subsidies, find an agent or go to the carrier direct. And a lot of people that should have done that ended up going to Cover Oregon thinking that's where I had to go to buy my insurance, and that clogged up the wheel just huge and just shut it down. So that's just kind of some feedback that we've given them, is they massaged it, over marketed it, and really diluted their message, which was to kind of, if you're Oregon Health Plan or subsidies, and they could have just kept it and probably been successful with it. But those are some of the feedbacks that we gave, that it was not necessary to think. But then, and I'm going to take some sugarcoating off the Cover Oregon folks, because through the Affordable Care Act, which I'm trying to call healthcare reform, because let's face it, there's not very much affordable about it. The Cover Oregon would have received a premium subsidy on every dollar premium that goes in. So part of their reason to market it to the public was, we want people to buy insurance through us, even though you don't qualify for a subsidy, because they get a kickback on that premium that was purchased. Where Tina and I become removed as the insurance agent of record, Cover Oregon becomes that insurance of record, and then the premium overrides go to them. So it's financial. It totally was financial. And I'm not going to sit up here and paint a greedy picture, but that's definitely a direction that we could see that they were going, and it bit them in the lower backside.
Can you comment on the federal, going to the federal exchange?
Yeah, it's going to be awesome. It's going to be absolutely awesome. So we banned it early. We've been talking a lot this morning, and we're in this together. But yeah, there's a lot that we don't know. But the cool thing that we do know is if you go to healthcare.gov, you can do exactly what you're supposed to do, which is put in how many household people in your family, what's your total gross income, which could also include, do you have a teenage daughter who's got a part-time job? You have to include that as part of your income, and out pops your subsidy, your percentage, and then from there you get to enroll. So it took them a while, but it works. How's it going to look like if you're on an Oregon insurance policy? We have thousands of people that jumped on the MOTA bandwagon. What's that going to do? The good news is MOTA is part of the federal player. So hopefully, and other groups like Kaiser, other insurance carriers that are out there with quite a few enrolls, hopefully that transition will be very smooth. But publicly, knock on wood for that one. But yeah, there's a lot that we don't know. Exactly.
Mark.
I think Tina and Tim pretty well covered that as far as what went wrong. The governor came by our offices for an editorial board interview about a week ago. He gave us exactly 30 minutes. And to sum it up in 4 words, he said, "It's not my fault." So, and then Dennis Richardson was here a couple weeks earlier, and he had exactly the opposite view. It is the governor's fault. And I think that the tragedy of the whole thing is we spent $250 million on something that's never ever going to be used, and that's just a heck of a lot of money to waste. So, but I agree, with the previous comments that the website isn't really, what is most important. Is are people getting covered, and that actually is occurring. So, there is some reason for optimism there, I guess, that the underlying system is working. And as far as what really went wrong, I think a lot of it, is what they said. And in addition to that, and they sort of alluded to this, is layering on other things that they wanted this website to do, so that it wasn't just you could go and sign up for health insurance, but you could do all this other stuff that was supposed to be unified with it. So, those were the changes that occurred over time that caused the thing not to work, and also for the price to continue to go up. So I guess that would be my thoughts on it.
Can you also comment on how the Tribune, as an employer, as an organization, is dealing with some of the healthcare issues, healthcare reform?
Yeah, I mean, if you want to get into that, just to give a little background, we're on the newspaper division, we have about 250 employees. So obviously, we're in that category of more than 50 employees. As a larger corporation, the RV Pamplin Corp is thousands of employees, more than 4,000 employees. So there was no way to get under the 50 employee threshold there. And so, but what's happening with the Affordable Care Act really isn't affecting us that greatly at this point. There's been a few little changes we've had to make. We're self-insured, so we have stop losses, individual stop losses on employees, but for the most part, the utilization that our employees have with our plan is what it costs us. So, if someone gets sick, we ultimately pay the bill. So there have been a few little tweaks that we've had to make, and some of this is due to technical reasons that I don't fully understand that our HR department has dealt with, but we lost our grandfather status, so we had to make some changes this year that other people might not have to make for another year or two. So, for example, and I don't even know if this was universal or if it just applied to us in losing the grandfather status, but some of the preventative care items like mammograms, immunizations, used to be that those are subject to deductibles or co-pays. Now we pay those 100% as just part of the preventative care. I think Lynn and I were talking earlier. One of the things that goes away is the lifetime cap on what a person might incur in terms of medical expenses. So, it used to be that we had a lifetime cap of $2 million. If one individual went over $2 million during their entire employment with us, then we weren't responsible anymore. I actually think that's a good thing that that went away, because I worked for a company once where somebody hit that $2 million, and it was not a pretty situation to tell that employee that they no longer had coverage. So, so little things like that just are tweaks, really. I think what we're doing is what a lot of employers are doing, and it's not necessarily related directly to the Affordable Care Act, but as we're looking down the line, we only see health costs increasing with time. And so we're doing whatever we can to try to reduce costs. And again, it's small measures, but for example, this year, and this isn't a mandate of the Affordable Care Act or anything like that, but we told our employees, if your spouse has insurance through their employer, we're no longer going to allow you to cover your spouse through our plan. And I thought, probably wouldn't be a big deal, right? Because you would think it would just be a handful of people, because our plan's far from a Cadillac plan. I mean, we have pretty high deductibles. Our employees, for an individual, pay, I think it's about $120 a month for their part of the premium, and then we only cover 70% when, after that, and so it's not a Cadillac plan. But the surprising thing to me was the number of people who came to me and said, "Boy, that really hurt me, because my wife or my husband was on my plan, and their employer, their benefits are far less than what we offer." And I was like, really? I'm surprised that we had that many people. So, that was one of the changes that we made, and it's really sort of a self-defense mechanism to say, we don't want to be paying for other people's employees. And so I think you'll see more of that. There was another newspaper company in Oregon, and they're based out of Bend, and they have about the same number of employees that we have, 250, 300 people. And they told their employees, we're not providing health insurance anymore. Go buy it on the exchange. And so, one of the disappointing things about healthcare reform in general has been that there was no real consideration for how do we get this burden off the backs of businesses, as opposed to, some other method of providing coverage. And I think that's going to be an ongoing issue, because businesses cannot be competitive if they're continue to be burdened with a rising cost. And so I think that's something that's just going to have to be looked at over time. Does that answer? Yeah.
Jerry. Morning. I'm not quite as giddy about the Obamacare as our agents and industry folks are. I'm a Adam Smith fan and a free market capitalist. I love metaphors, and let me throw one out at you. Back about the early '60s, NASA wanted to figure out how to create a pen that wrote upside down. I think most of you in this room remember when they finally invented that pen, and how cool that was, that you can then stand upside down and use that pen. So, but for years, they couldn't figure out how to do it. And it cost millions of dollars to create this pen. Guess what they did in the meantime? They used a pencil. And I think that's just classic in today's economy, with so many things that the government does. In this particular case, I think Obamacare, or ACA, Affordable Care Act, had two premises that they were trying to achieve. Number one, they were trying to take care of those indigent folks who did not have insurance, and then they were, or they could not get insurance because they had pre-existing conditions. And the government wanted to create an environment where all individuals, regardless of pre-existing conditions, could get insurance. And that's, I think, a very valiant, noble thing to do. Number two was to reduce or terminate or abate the increasing costs of insurance, because over the years they've continued to rise. So those are the two premises I think that ACA is trying to achieve. However, while number one I think is readily within sight, number two is going in the opposite direction. The $250 million that the government, first of all, wasted on this computer program, which is not the first time Oregon has wasted money on computer programs in the state of Oregon. I think this is, number three of a significant computer program that they they've wasted millions and millions of dollars on, which is very, very distressful. But the 275,000 people who signed up for Cover Oregon, 2/3 of those were just for Medicaid and other subsidies. The other third possibly could have been some of those who actually had insurance and dropped it so that they could get a subsidized insurance plan. Who pays for all that? Who pays for all that? We do. Costs are going to continue to increase. I know that the city of Gresham spends $7 million a year on health insurance for their employees. For a family of 4, it costs $1,500 for a monthly premium. That's just outrageous. They have had 12 to 13% increases in their insurance yearly. It forced them just this last year to go to a self-insured program, which, again, I think there's going to be a lot of companies and organizations go to that end. But again, very expensive, and the HMO portion that they do have represented about a 7 to 8% increase. My personal business, I have 150 employees, and we averaged 0 to 2% increase until ACA hit. Then all of a sudden last year, for the first time, they wanted to hit us with a 16% increase. Again, who pays for all these that private insurance is not covering? So I think the Obama premise is that there were going to be so many people. This is the way they're going to achieve number 2 in terms of lowering costs, that there are going to be so much privatization go on that costs will actually go down over time. But that hasn't happened. In fact, it's just the opposite. Again, putting on the government dole, all those individuals who don't have insurance are very costly because they have pre-existing conditions, and all the companies, businesses, private individuals are going to pay that cost over time, little by little. So that's kind of my feeling about it. In our industry, my industry, the National Auto Auction Association, we have 302 auctions across the country representing $74 billion worth of revenue each year. Those businesses, talking to some of those business owners, there is one, for example, who broke up his business in so many pieces. He wasn't really thrilled about having to pay health insurance. Now, we love paying health insurance for our employees. We want to take care of our employees. This particular individual was not so altruistic. He broke his company up into a million different pieces just so he'd fall under that 50 employee line so he wouldn't have to pay anything. It was kind of a crazy move, but there are companies out there who will do a lot of different things to sidestep this, and it's not very productive. So that's kind of my 2 cents worth. I think while the vision is wonderful, I think the application of it has been horrible, unconscionable. Again, if there's 13 states that have figured out how to have a private computerization program and we couldn't, I mean, where's the economy of scale there? How come we didn't use them? Or how come there wasn't some level of consistency within the states? It just doesn't make any sense to me. And I know there's a federal investigation. It'll be interesting to see what they come up with, other than they blew it. I think that's just more money after bad. I think they could probably come up with that solution really quickly. But that's my 2 cents. Thanks.
So next, this is for Tim and Tina. So Tim, you were here, I think exactly a year ago, to speak to us to this. And Tina, you've been into this for a long time as well. Is this pretty much going as expected? Is it how you expected it to go? How do you assess it? Are things going better or worse?
Yes. Well, let's carve it up a little bit. Let's talk about the individuals, because the law where on January 1st, 2014, every American had to have health insurance. So that didn't mean that everybody had to go to every exchange. That just meant that if we weren't getting it through our employer, we had to go find it ourselves. And sometimes that meant our employer was carving it out to reduce the amount of people in my family that I could normally get it through my employer. So we had some of those issues. So there's that part, and then we had those that were in already state-sponsored. We had subsidized plans, everything rolling, so we had take them from Group A and move them over to Pod B, which was a lot of what the business owners here were talking about. Is we had people that were already insured, so now do we have inflated numbers because hey, we put 198,000 people, but most of that already had insurance to begin with. So what did we really grow at $258 million? I think we grew at 60,000 net numbers. So that's congratulations to them. So then we had, the small businesses where basically if you're 50 and under, there's been zero effect other than the look and feel of your insurance product has changed. There's no law that says if you have 12 people at your print shop that you have to have insurance. If you weren't offering it before, you don't have to offer it today because really the law only impacted the larger businesses as stated. So then in 2014 it was pushed off to 2015, and now we're being told that really the penalties, the issues if you're offering insurance or not offering insurance or choose to cover up your business, do not have to be a large employer, those penalties, those taxes, won't be assessed until 2016. So really what are we gaining from this? So far nothing. Because nobody's really being held accountable to do anything since the law became the law on January 1st of 2014. So I guess it's a little premature for your question, Andre, because we don't really know on how this is going to enact. If you're an individual and you didn't buy insurance, it's 1% of your annual gross income or $98, whichever is more. So if you are no income or low income, there was really no push to have to get insurance. And if you're a small business owner or you're an employee of a small business owner, that's an issue. But really where it came into impact was the large employers, which I think was unjustly so. If we're going to enact something that's going to have to be a broad brush across the country, it should impact everybody, not just the large employers. So the long and short of your answer is we'll see, because really IRS is still trying to figure out how to go after businesses, how to penalize, how to earn some of this money that the federal government thought they were going to make from these penalties on large employers, and we have yet to really see how that's going to impact. We keep hearing that they're either going to carve out employers. For example, in 2000, so starting January 1st, 2015, if you're a large employer and you're not offering insurance, you actually get to subtract 80 employees from your coffers before the penalties hit. In 2016, they're going to take away that 50 and give you the minus 30 that's written in the Affordable Care Act. So if you have 200 employees, you're not offering insurance, it's a $2,000 per employee penalty. Subtract off 30, you'd only get fined 2,000 times 170. So they're starting to kind of, we're almost there, but who knows what that will look like? Who knows how and if they'll come knocking on your door? And what about those large employers that have key people that are carved out that we currently offer insurance to? What's that going to look like? So we might be a little premature before we say that things are going to work out.
Tina, want to chime in?
Always. Try and stop me. No. Tim, I think, is certainly an expert on large employers. The vast majority of our business at Jackson Benefits are individuals, but small groups, certainly under 50, and a handful of micro groups, 5 and fewer, that we'll talk about in a moment too. I think for individuals, from my own experience, I've seen this work out. Everyone came, all right, I have to get insurance, right? I can't tell you how many calls I had from mothers. Would you please call my son? I'm tired of calling him. He's 23. He has to do this. He won't. He says I'm nagging him. I'm like, all right, I will nag him. So I ended up with this. You know who you are. These kids. A lot of people did get insured that weren't before. I would love to see how the IRS is going to try and penalize people who didn't have the insurance. And then with the moving of the deadline for open enrollment, if you have it by March 31st, you're fine. Oh, but wait, now you have until April 30th. But if you still enrolled in April, you are subject to that penalty for not having insurance. I'm sorry, if you enrolled during the month of April for May coverage, you're still got this month where you could be penalized for not having had insurance for that 1 month. It's going to be prorated. It's the 1% or the $95. Good luck with that. I don't know who's going to do that math and go after everybody. For small groups, I don't think that any of this has worked out well for them at all, other than, Well, I don't know. I mean, the increase in benefits, I'm just, the preventive care is all included in these plans now, and the removal of the cap, excellent. The benefit cap, that $1 million, $2 million cap, that's really nice. What it's costing the small groups are increases in their rates of an average 35%. From Kaiser, groups of 10 or fewer, our average increase we saw was 45%. So it's crazy. So what we did, and that was those were January renewing groups, January, February, March. We were looking at those groups. They came in with these up to 45, sometimes even higher % increases across the board. So what a lot of them did, they decided to take an early renewal in December on a 13-month contract that was offered to them. So they don't know now what's going to happen. They just decided to stave this off for a year. So now we had almost 100 groups move to a December renewal. So, you think you didn't see me for the last couple months, around October, forget it. Not going to see me then. But it's if they've decided to keep their insurance, it's costing them a lot more money. The micro groups, 5 and fewer, what I've been saying this morning is that it's made more sense for them to disband. They don't, they're not paying their portion of the premium anymore. Employers can't pay for individual policies, so that takes that off. Now, what they've done in the meantime, and maybe someone like Jared could explain the implication on, okay, we're not covering you anymore, we're not paying for your premium, but we still want to kind of offer you benefits, so we'll gross up your pay a little bit. How does that affect employee and payroll taxes, things like that? I don't know how it works out specifically for employers, but they've disbanded. It makes more sense. They save more money going to individual plans. So that's what we've seen a lot of in the smaller groups. Does that answer that a little bit? So we'll see. Kind of afraid to see what happens at the end of this year.
I want to open the floor for questions. Oh, go ahead, Mark.
Well, I don't remember what the question was now. It was what? Yeah. But I would just wanted to add that, behavior will change as a result of how this is implemented. And so we're looking right now, not that it's a huge portion of our workforce, but what's the definition of a part-time employee going to be? Because that's going to change our behavior. A year ago, I told all our managers, if you have part-time people, don't let them work more than 28 hours a week, because I don't want to, have to add them to our benefit plan a year from now. And then, of course, that got delayed. And now there's some talk, which I think is smart, to say maybe we should change that to make it, you could be part-time if you're below 40. So that's one of the things we're watching, and I'm not sure how it's going to turn out. But I think our behavior as businesses will evolve and change as this rolls out.
The original question was is this what was expected, and how are we coping?
Yeah, I think they blindly just threw this thing out there, and they had no idea what to expect. And I'm grateful that we have another year to figure out what we need to do. We had all kinds of contingency plans in place, and now we've got another year to figure it out. But again, there's a precipice there, and we still don't really know what the implications are. I think a lot of companies are going to go with a self-insured program. But again, it's not, that penalty is not just $95 or 1%. Next year it goes to $325 or 2%, and in 2016 it goes to 2.5% or $695. Again, how they plan on mapping that, I don't know, but it becomes a significant amount of money, and certainly I think would be considered a tax. So,
I'd like to open the floor for your questions. Well, Larry, and then
I locked out the first one? Okay. Well, a couple of comments, and then I guess I'll ask the question. First of all, Tina, I wish I would have had your phone number a few months ago when I was trying to convince our 26-year-old daughter to make that call. Yeah. And from the consumer standpoint, at least from when I was trying to help my daughter, trying to wade through that muck and mire was horrendous, and we finally just said, call a broker because we can't figure this thing out. But I think, seeing the increases that we're seeing currently in premiums, and this is just Larry talking, it's kind of unfortunate timing that two of the largest venues in the Portland area are now named after insurance companies. That's probably not a great marketing tool on their part. Finally, for the question, you know, the elections are coming up. There's been a lot of harumphing over the years about AHA and the possibility of Republican control in Washington. Do you foresee, and this is for anybody, do you foresee a dismantling of this program or modifications? And if there are modifications, what might we see?
We're here until 3 o'clock, right?
Well, I was gonna say, anybody got a tea time this evening? We'll be here till then. That's a tough question to answer because the longer we spend with Democrat-controlled Senate, the farther the tentacles reach into the business community, our society, and a couple of the things that we haven't yet addressed this morning are, I think there are going to be some good things that come from this discussion because this is the first time ever that all constituents involved in healthcare reform are now sitting around the table. And what's tough is we do have for-profit insurance companies. We do have for-profit hospital systems. We do have for-profit pharmaceutical companies. I mean, we are a capitalistic society. It's the basis of our country. Okay, step off my soapbox for a minute. So how do we equate that to when I go see my doctor and had a physical last week, 2 weeks ago, and instead of getting to know me, it was getting to know Tim's insurance? Versus if somebody comes in off the street and wants to have a physical, mine happen to be free because I have insurance. If you come in off the street, you don't have insurance, your physical is going to cost you $200, probably plus about another $80 for the blood draw and the lab work and stuff. But all that for me is free because I have insurance. So what we're starting to see with these accountable care organizations, these community care organizations, and these smaller networks with these insurance companies is we are starting to see a reform in how care is delivered to the member. Whereas if there's a type 1 diabetic, instead of going to the ER, if you're with, ABC insurance company, they're going to steer you to one of their medical homes where maybe you see a licensed practical nurse instead of a specialist. So now did the cost for that insulin or did the cost of that appointment come down? And we're just now at the tip of the iceberg seeing some of those changes, which I think long-term are going to be good. Is it going to change what we pay as consumers on our insurance costs? I don't know, and we're too far involved in that. But one of the cool things I think that is coming from this is we're now starting to all come to the table where it was the pharmaceuticals just complaining about the docs and the docs complaining about Medicare complaining about the hospital systems. We're all starting to come together as a unit coming into this because we all have some skin in the game, and it is costing a lot of people a lot of unnecessary headache and cost to do this. So are some insurance premium things going to happen? Are we going to deal with this as business owners? Yeah. But I think at the end of the day, and this might be 6 years, this could be 8 years, this could be hopefully within my lifetime, can we start to do this where it is true consumerism? The story I tell people is when I need to buy a set of tires, I can spend all kinds of time researching on the internet. But if I need to get my left knee scoped because I think I've got an ACL issue, where do I go to research outcomes? Who's got the cleanest, healthiest doctor's offices? Who's got the quickest response? How's it gonna take my Regence Blue Cross Blue Shield insurance and reduce my out-of-pocket costs? I've yet to be able to find that, but I can find 1 million people that want to sell me tires for my truck. So I think we're now starting to see how transparency through this is really going to impact this. Sorry, it's a long answer, but I think that's what we're going to start to see through this. And is a Republican change in the Senate or Republican change in the White House going to do that? I don't think it's going to matter who's in office. This thing is now starting to get so deep into society that would a change in the Senate and a change in the White House repeal where we're at? I don't know. I wouldn't put a lot of faith into it.
I hope Tim's right. So in terms of it's going to work better going forward. In terms of the politics, I mean, if the Republicans take control of the Senate, they still won't have a 60 vote majority, so it's not going to be repealed. And Obama's still be in the White House for until what, another couple of years, so it's not going to be repealed. And Monica Webby took a lot of grief earlier in the campaign before she took grief for other reasons, but about saying simply, okay, I want it to be repealed, but that's not practical, so therefore I'm in favor of changing it and reforming it. And so, but she was right about that, because the political reality is it won't be repealed, so we have to figure out how do we make it better going forward. And the problem is that you have such entrenched interest in terms of the Democrats. If you talk about even changing it, it's like, oh no, you can't change it because it's sort of their holy grail, and the Republicans are insisting you have to completely repeal it or nothing. And so how do you get to a point, as Tim was talking about, where you bring all these interest groups together and actually say, how can we make this work? And that's what I'd like to see. So.
I have 17 questions. Transparency, for one thing. You talk about transparency, but a tire you can test, you can run, and every tire is the same, but every knee is not the same. And so the transparency you're looking for is going to cause a nightmare, because all of a sudden, as a healthcare provider, if I know that there's going to be transparency out there, I'm going to say, hey, I'm not going to touch that knee because I know that it'll go on my record, because the chances of success are so minimal that I'm not going to touch it. So no one's going to touch it, and the people who do will be hit so hardly that no one will go to see them. So when we ask for transparency, watch out, because that's going to kill the doctor's desire to see anybody but the healthiest. Then who's going to treat all those people who aren't? And so we talk about transparency. That's the worst thing. It sounds great in theory. Be careful what you wish for. My question, I guess, would be, is that right now you're required to cover, as insurance carriers, you're required to cover all the stuff that, in my mind, you should be paying out of pocket for. I mean, no deductibles absolutely is an asinine thing to do for any product, for anything that we do, because then you have no vested interest. Because like you said, I go to the doctor, it's free. Well, it's not free, because the premiums are going to go up. But what's happened is that they've given for the next year or two, I don't know how long it is, that the government's going to, if an insurance company has any losses, the government's going to cover those losses. Is that not correct? So the premiums aren't going to go up for a while. So we're really not going to have a true idea of what the premiums should be. And when we finally do hit that, because of all the things that have been mandated that have to be covered, when those things finally do get into the premiums, what is that going to do to the price of premiums when all the artificial barriers are gone and it's actually going to hit the real market value of what it should cost? We talk about 45% for Kaiser. What's it going to be when all those artificial barriers are gone? And also the artificial barriers, when Medicaid goes from 100% reimbursement rates in 2019 to 90%, when the states have to pick up the other 10%, where is that going to come from as well?
Right, and that's, a lot of that, wish I had a crystal ball. Some of that, I truly don't know, but we're going to have to really wait and see on a lot of it. The 45%, increases, 25 to 45% increases we saw were just in advance of seeing what was going to happen. That was the insurance companies kind of hedging their bets and saying, okay, we have to take all comers on the individual market. So let's try and, bring those rates up, because of course every carrier is convinced that everybody who needs, an organ transplant is going to enroll with them, and all the, least healthy people are going to enroll with them. So they'll try to jack their rates up. And then very publicly, Providence and Kaiser got smacked down last summer by the insurance division for, jacking up their individual rates too much, so they had to scale those back a little bit. So all the insurance companies said, well, you know what, let's try and pad this then. Where can we get this extra money? Oh yeah, let's hit the small groups. We'll just kind of pad that in, see what happens, and so forth. So all of these huge increases were just in advance. Now, with the enrollment, the way it shakes out, I don't know, I would assume that since MOTA picked up at least 75% of all the individual policies, I mean, they hold 75% of the market share in individual right now, maybe they won't have to raise other rates as high. Of course, the rates do this all the time. I don't know. It's like I'm doing their underwriting over there, their math, seriously trying to forecast that stuff. I'm more of a people person. But thank you for that. No, too late. Don't laugh now. It's too late. So, in it, in the future though, we'll have to see how the enrollment shook out. Did the number of people who enrolled either in or out of the exchange help bring up the numbers of, the premium numbers then enough to kind of even things out? Hard to say, but for future, I don't know. If this is what happened in advance, we'll just have, and I don't think that the insurance companies will even know what the result of all this enrollment was for them and meant for them loss ratio wise, until probably September, October, when they've already had to file their rates for next year in June. So we don't know yet. So I don't know, any other comments there?
How about this for some fiscal conservative good news, for a good thought as you're closing your eyes tonight and you're back to your pillow, reminding yourself of how enlightening our discussion was this morning. So a consumer that's on a healthcare.gov or a exchange Cover Oregon plan really has between 90 and 120 days to make a premium for their plan. So, and let's say that's just a rough, we'll just do the 50% math. So if I sign on, I got a 50% subsidy, I found a $300 plan, I'm paying $150 and CMS is paying another $150. I can go 3 months without making a premium payment, but I can go in tomorrow and get back surgery. And I can decide I can decide that I'll never take a premium payment, and the only thing that collections is going to come after me is probably 3 or 4 months worth of health insurance premium costs. So if we look at the $7 or $8 million that healthcare.gov signed up nationwide, and I'm not trying to paint a broad brochure and saying people are just going to do this, but you got to think, if people can work the work comp system and people can work how to not, license their car in a certain state or whatever to kind of work the laws, legalese, people are going to figure this out. And so I think the bigger question when we take a look at financial responsibility and cost and the true curve in this matter is what's that going to cost the American people? That not only did I sign up, I got my insurance, so I'm at the moment I'm legal, but am I going to pay a dime of my insurance premium, and how many times am I going to go see my doctor? How many times am I going to walk in the ER and get something done? That's my concern.
Well, and actually, this question actually is mine, and this goes to Mark. Can you comment on your visit with the governor, and what was some of the? He said, well, this isn't my fault. Well, whose fault did he say it was?
I'd have to go back to my notes to give you the detailed response to that, but essentially it was, we talked about the 3 criticisms that Dennis Richardson's leveled against him. Cover Oregon, Rudy Crew, and CRC, which I think the CRC, I don't blame the governor for that. But the other 2, it was essentially the people, who were working for him, who are now gone, or oversight groups like with Rudy Crew, who were supposed to be, watching the store, and they weren't watching the store. So it was basically, he's putting the blame on Oracle or on the people who work for him. So, yeah. And then, he had a lot to say about, some of the stats that were rolled out here about how many people have actually signed up, not through the website. So, yeah.
Someone else has a question. I have another question. The VA is making the news right now because of the care that's being put off. But if we sign up an extra 60,000 Medicaid employee or eligible people, and I don't know how many 80,000 private people, so we dump 140,000 people into a healthcare system that's already in wait. Are we going to have rationing by waiting as more people sign up? The goal is to have everybody signed up, but yet medical schools aren't producing more doctors. Dental schools aren't producing more dentists. What are we going to do when all these people who typically have been the least healthy, who need the most care, all of a sudden start flooding our medical facilities? Is there going to be basically, even though it's not a government-run program, which it isn't, it's not the Canadian system, but it is government-mandated program. Are we going to have rationing by waiting, in your opinion, you insurance people or anybody?
Well, we're adding a bunch of people now to the insurance coffers that didn't have insurance before, and they're going to be like, well, great, I got a doctor now. So hopefully the idea is I'm going to go see my primary care physician or the doctor down the street because it's part of my PPO plan for the insurance I didn't have before. So what's that going to do for people like me that had insurance that now, or I need to take my daughter in for an asthma thing or whatever like that? Can I get in to see my doctor? And or if there is going to be a penetration issue, am I going to be forced when something happens where I could go down to Oregon City Family Practice and get my daughter's asthma prescription refilled as needed? Is that going to be an issue where now I'm going to have to go to either urgent care or the more costlier, which we're trying to keep people from, which is ER? So are there parts of Oregon that I think are going to go full circle and we're going to go back to the expensive cost of healthcare? Yeah, take Portland metro area out of the equation and look at the rest of the 85% of the state. And the answer is yes. There are not enough licensed practitioners to serve our rural communities. We have that issue now, and now that we're not really forcing, but people are having to come into the insurance coffers, and we want them to go to those private practice locations. Is there enough to handle it? And the answer is no.
Good morning. I'm Michael Patrick. I apologize for being late. You may have covered this, but well, I'm sitting next to some smart people over here, so I can look over in their paper. Anyway, could you talk to us a little bit about HSAs, health savings accounts? Is that part of the solution for this accountability as far as people taking responsibility, their own money, the transparency? Is that part of the discussion or the solution to what we're looking at, and is there a place for that? I mean, I'm part of the 75% of the self-insured through MOTA, so I guess I'm in good hands. But anyway, but could you explain at least to me or to the group a little bit of how an HSA would work as part of the solution, and as opposed to the private insurance? Does that make sense?
Okay, so health savings accounts have been great vehicles for people who are smart about their health care, and primarily for those who really want that tax savings vehicle. A health savings account is something that is paired with a high deductible health plan, the kind of outline of which is designed by the IRS, so you know it's awesome. So they say, so basically this is the plan. Thank you. All right, thank you. Okay, got it. See, now I know my audience. So basically, an HSA plan used to be an MSA plan. These are plans where basically nothing is payable until you hit your deductible. The deductible at this point for individuals, $6,350, matches the out-of-pocket maximum. So on the one hand, that's nice that that's your cap as far as your outlay for medical expenses will go during the course of the year. That's great. You can put money into your health savings account on a tax-deferred basis and then take it out to pay for medical expenses, approved medical expenses. Money comes out on a tax-free basis as well. You can roll it over from year to year. If you don't use it, you don't lose it, which is really nice. That would be different from flexible spending accounts and other employer-based plans. HSA users, in my mind, are really responsible. They're people who, can afford to pay for their insurance. And, if you have to pay out for every service that you use before any insurance would really kick in. I mean, the only thing that the insurance is there for in an HSA case really is to have a cap on your costs for the year. That becomes more like car insurance. Car insurance doesn't cover your oil changes. It doesn't cover filling up the fluids, that kind of stuff. It works pretty much that way. You're paying for everything. It's just there to protect you if something big happens. So I don't know. I think that, responsible people use it wisely. You are more responsible, each time you go. Do I have to go to the doctor? Do I have to go to the urgent care? Can I wait until tomorrow to see my doctor? If you're paying for that care yourself, you're going to think twice about it and not be such a high user. That's been my experience. Would you agree? So anyway, does that answer your question a little bit?
Doesn't that make more sense if that's what we should be offering instead of what we have now?
Oh, they're offered, and it is, HSAs are, sold by private insurance companies and so forth. We could move that way, but it seems that, what about all your free stuff? Who's going to cover all the free stuff? I want my, visits and this and that. People don't want to, and now that they've got it, good luck trying to take it away. I've tried that with my cats. It doesn't work.
And I would also like to hear from our large employers on this, because it seems for the employees that Tina and I insure, when we get into an HSA situation, you've got a $2,500 deductible, you got a $6,350 annual max. Every time you access your health care, you're paying out of pocket. And the grumble that we hear from our members, and I'm not sure how you guys would answer this regarding your employees, is especially if there's some skin in the game where the employee has some money taken out of their paycheck to cover that HSA account. The second thing is we have to educate them on the necessity and the importance of setting money aside for your healthcare account. So not only are you paying for the insurance part, we need you to put money aside in your savings account. So we start teaching you how to be intelligent about the access and the use of your care. But then every time they go in to see a doctor, or they have a this or they have a that, they're paying 100% of the cost up to deductible. So the gripe that we hear is, well, why am I paying for this if I don't have insurance? And it's like, well, you do, but it's different. And you have to, it's a different spin on it. And it talks about the need for consumerism, and the need that, well, if an urgent care visit is less than the ER, can I just get a big fat duh and let's go to the urgent care? But so many people are grained on how they use their care. So I think HSAs have a definite place in our society. I think there's a definite role that groups are looking that way. But it's a change on how we educate and communicate this to our employees on there's more to this than what you've had in the past. And so we're getting there. HSAs are a lot bigger on the East Coast and the West Coast, where the wheel is moving a little quicker here. But it does involve a lot more education and communication that here's what you have, and here's some other responsibilities you have to do. And then are the employers strong enough to say, yeah, we want to encourage you to do this as a base plan or an entry-level plan, because there is some extra griping and cost involved, I think, to put one together. But it's a good question.
Yeah, we're somewhat encouraged by that program. More than likely, we're going to revert to that when this precipice hits at some point, whether it's 1 year or 2 years down the road. We as a company will probably have to prime the pump for our employee, provide $1,000 or $2,000 in that account to get them going. Otherwise, I think that the level of grumbling would be exponential at that point. But we see it as a goodwill effort and a way to make the program actually work. But that stop loss feature, with a managed health care plan, we've all had that stop loss understanding of our employee at that level. They have a general idea what that means. And so this is just a different aspect of that. And I think it's pretty intuitive. And certainly with the way things are going, I think it's probably very likely the way we'll go, and I think many, many others as well. And why this program wasn't initiated in the very beginning, good question. I think it definitely would have been a much more realistic, long-term, usable mechanism.
Jerry, stay up there. And for our closing comments, I'm going to have you and Mark as employers speak to what are the practical steps that you will be taking as businesses in the foreseeable future as it comes to healthcare. And then our insurance experts, what is some practical advice that you give to a room full of small business owners?
Well, again, just like I'd mentioned, we're evaluating what the cost features are relative to the self-insured programs. As for the city as well, they just started this self-insured program just recently. I'm interested to hear more about what their experiences have been. So Kurt and I will go back and ask some questions about that. But again, it's very, very fresh with them. Kurt, do you have any? Yeah. Okay. Good. But we spend as a company, we have 7 auctions in the West Coast, which represent probably about 4,000 employees, and each auction's in a different state. So we have a very interesting dynamic there in trying to put our arms around it when you're dealing with all the different variables regarding the state. So we don't have our arms around it yet. So, and I think most companies don't. So to say that we've got a game plan really would be untrue. So I think we're like a lot of other people. We're in the dark, kind of feeling our way through it.
That's pretty accurate, pretty fair. We're still trying to figure out what the next steps are. I mean, for us, it's really about how do we control costs going forward, and having the employees have a little more skin in the game. Although our employees have a fair amount in there already, is one tactic for doing that. There's also a lot of just record keeping and proving to the government that you're doing what you need to do. That your plan meets the minimum requirements, that it doesn't exceed the maximum. You have to stay below, I think it's 9.5% of an employee's wage. You can't go above that in terms of what it costs the employee. So, there's a lot of that sort of stuff going on in terms of just documenting things and being able to show where we are as this continues to roll out. So I don't know that it's going to have a huge effect on us because we're already self-insured, but it obviously the things that have happened already have sort of incrementally increased our costs, which we've passed a little bit of that on to the employees, but mostly we're shouldering that burden. I would imagine as we go forward that the employees would have to see more of that.
Practical advice going forward: call your agent. Call your agent. I mean, honestly, there's so much that we don't know. But the first people are going to know. Well, at first it's going to be splashed headlines. But when the information actually trickles down, we're the ones that actually are going to need to be certified, go through all the trainings and stuff to be accepted as being able to sell healthcare.gov and be part of their program. There was extensive training for the Cover Oregon program. So, that's information. We'll have the information as soon as it's available. Especially Tim has worked through the Portland Association of Health Underwriters. The National Association is a group of insurance agents and health insurance company representatives. This is the Insurance Association. And so any news from there, any guidance is going to come to us from them. That's something we can always count on them for. So yeah, really, that's my advice. Get to know your tax guy really well and keep him close by. Put his number in your speed dial, Jared. And the other, call your agent, seriously, because it's going to be crazy. We don't know what's going to happen yet. So, and again, I don't think the insurance companies do either right now, but we'll weather it together, right?
I'd probably say in closing that one of the things that the healthcare reform lacks is accountability. And I think that if we can take the accountability and consequence to ourselves, to people, us in our room, and making sure that we know what we have, and if we are a small business with employees that are offered insurance, can we kind of take it upon ourselves to make sure that they know how to use what we have, and can we just take it at that kind of minutia level and just start from there, and then can it go to their families? Can we talk about better choices for grocery shopping and cooking and eating, and we can drill it till they're blue in the face in our offices, and especially if you're in a self-insured plan, you can definitely direct this yourself. But what do we do when our employees get home and are on the long weekend or they go on vacation? Is there some things that we can do just to keep them from being an extra claim, or if they're on a prescription drug, can we get them information on better education on maybe is there a way to manage this with better diet, exercise, or generic costs instead of a brand drug? There's so many things that we can do, but I really think it comes down to us and individuals and our own level of accountability, and can we lead by example? So whether you're a large employer or a small employer, or like myself, I'm a sole proprietor, just can I show my daughter better eating, better exercise, better way of life, and maybe can she help take that through her friends or something like that? I really think that's what we can do, and bring some accountability in this back to ourselves, back to our businesses, back to our employees. A lot of us are paying a lot of money into this, and I really think there's a better way than just griping over the cost of your premium increases, is make this personal, be accountable, and And can we, through that, through our own civic organizations, through this chamber, through our own associations, can we fix it that way and just deal with the elephant that's in the room and see if we can make some change that way. So that'd be my final thought. And then, of course, just tap into Tina as much as you can. She's a great resource, small business, individual, however, and just keep her busy and keep her phone ringing because she is a very strong advocate as well. And I really think that if you've got questions about your children or your neighbors or you heard this at a dinner party or Tina might be at that dinner party, who knows? But so anyway, but yeah, thanks for letting us come. I think it's been a great, thanks for taking time out of your morning to be involved in such an enlightening, low-key, unimportant discussion as healthcare reform. But so thanks for having us.
Let's thank our panel this morning. Jerry, Mark, Tim, and Tina, thank you so much for joining us. Please take a few seconds to fill out the eval forms on your table, which gives us feedback on topics and speakers as we plan our speaking calendar. And I have a feeling that perhaps next year we'll have some incremental certainty as to healthcare reform, and we'll have this topic back again next year. Please join us next month on June 24. Our speaker will be Ruth Miles, who is the small business advocate with the Office of Secretary of State here in the state of Oregon. She is a friend of mine, a friend of the Chambers, and I tease her that on her business card it actually should say, "I'm from the government and I'm here to help." And so she's going to talk. She will be talking to us about how Secretary of State and her office helps small businesses in Oregon. Have a great rest of the week, and thank you again for coming this morning. We'll see you next month.